It's estimated more than 500,000 Canadians suffer from hepatitis B or C. A further 65,000 have HIV. CBC News medical specialist Dr. Karl Kabasele joins me now to discuss the issue further. And so, Dr. Karl, what are the kind of situations that can raise people's risk of exposure to these viruses?
Well, basically, the transmission of all three viruses requires contact with, intimate contact with bodily fluids. For example, sexual contact, because we know the viruses can live in semen, in blood, etc. As well, mother to baby, there can be transmission while the woman is pregnant and also during childbirth. And the third way is sharing contaminated instruments. So people who might be IV drug users who share instruments, there's always the risk. Plus other settings, such as personal service settings, you're getting a tattoo, you're getting a pedicure, manicure, there is that theoretical risk that a contaminated instrument could infect you.
And so what are the different ways in which a person can lower their risks?
Well, going through the categories, so in terms of sexual contact, using barrier protection, latex condoms, and so on, and limiting the number of partners that you have, knowing their sexual history. When we talk about the mother-to-baby transmission, actually women who are pregnant can take antiviral drugs in terms of HIV to prevent that transmission or reduce the risk. And then when we talk about contaminated instruments, if you're an IV drug user, avoiding sharing needles, for example, but also going to needle exchange programs. And we know that in most municipalities there is some mechanism by which personal service settings are inspected by public health officials to reduce the risk of those instruments being contaminated.
Dr. Karl, thanks very much.
Thank you.